Hi, I'm Dr. Angelique Ramirez. I am the Quality Medical Director for Foundation Health Partners, and I have a presentation that I'm going to share with you today. It's about connecting the dots. There's been a lot of information out in the media, and a lot of people have a lot of questions, and they don't understand why this outbreak is different than anything we've experienced before. And it is complicated, but I have a few slides that will help make it simple so that you can understand why we're giving you the advice that we are giving you and why it is so important to comply with it and how it will make a difference for our community and keep us safe. So first off, this is a very different disease. One critical point is that it is a new disease. We have no experience with it previously. We are constantly learning. We are constantly getting information from China, from Seattle, from Italy, and we're incorporating it into how we are preparing and how we are planning to deliver care here. But it does mean we are constantly having to learn and change everything we do as more information comes to light. Another critical thing about why this outbreak is different is that this disease is very contagious. It spreads very easily. For every one person who is infected, 2.5 people on average will get the infection. It is spread by droplets. So droplets are the specimens that come out of your mouth, like when you're coughing or sneezing, but they also come out of your mouth even in normal speech. So that's why we're asking everybody to stay 6 feet away, because sometimes those droplets can come out 3 feet away, 4 feet away, 5 feet away, and you don't even realize it's happening, and that can create infection in other people. The other reason that this is different, it's very important to understand that based on studies coming out of China, 80% of those who have the infection have a very mild illness. Sometimes they don't even realize that they are ill. It's a low-grade temperature, it's a little bit of a cough, and so usually we go about our normal day-to-day business with those type of symptoms. However, you're infecting other people. The other critical point here is that 14% of people will require hospitalization and 5% will require ICU care. That is care that we are very able to deliver here in Fairbanks. It's not so easy to deliver though if everybody requires it at the same time. So what else is different? So a lot of people have asked, so is this kind of like the flu? Is it a little bit worse than the flu? Well, the flu, here's a graph that explains the fatality rate for the flu. It's the black bar on the left, 0.1%. With COVID-19, it's about 12 to 20% higher for the fatality rate. And as you can see, the distribution is much higher for the older adult. This is a little bit of a complicated chart, but I thought it was really important for people to see this to help understand. This comes out of Wuhan, China. At the time, so I'm going to use a term called lockdown. So it's an unfamiliar term, but we use it as physicians to describe the point where the city was quote-unquote locked down, where they implemented social distancing and asked everybody to stay home. At that particular point in time, the yellow bar represents the number of patients at that time who had a positive test for COVID-19. It was only 400 people. The blue bar, based off of research that was done later, represents the actual number of people in the city at that time who had the infection. At that time, it was 2,500 people who had it, even though they only had 400 cases. That's why they locked down the city at 400 patients. So this is a chart describing the symptoms. The most common symptoms are fever and dry cough. Flattening the curve. This is a chart that's out in the social media lately. So this is a description of how an epidemic occurs, a new outbreak. The red part of the graph describes what happens in the natural course of a new disease. You have a high peak and then it slows down. The problem with that, if we allow that to happen, is that everybody gets sick at the same time and it can overwhelm our healthcare system. If we can slow down people getting infected and getting ill, we can take care of everybody the way we always do without any problems. So here's an example of 2 cities back at the time of the Spanish flu epidemic, and one city followed the rules with the lockdown and another city chose not to. Philadelphia did not follow the lockdown advice, and they went ahead and had a parade and large gatherings and overwhelmed their healthcare system and had a much higher fatality rate. St. Louis at the time of one case, they immediately locked down their city. Everybody complied with it, even though there was pushback, and they had a much, much lower fatality rate. So here's the graphs. At the time of the Philadelphia lockdown, Spanish flu in 1918, only 40 people were infected, but it was already too late. And you see the high peak for the fatality rate. And fatality is a fancy word for death rate. The dotted line is St. Louis, and you can see how the death rate in St. Louis was flattened out and spread out over much time and far, far lower. So this is why we're asking everybody to practice social distancing. Something totally new. We've never done it before. But here's a pictorial graph of what that means. Again, same facts as I shared earlier, that for every one person will infect 2.5 people, but that multiplies. It becomes exponential. So at the end of 30 days, you have 400 people infected. But the bottom part of that graph, if everybody stays home, if everybody practices social distancing, you only have less than one person infected for every person. And guess what? In 30 days, we only have a few people infected from that, and we can take care and provide excellent health care. The experience in Seattle, where they did not know this information at that time, we are fortunate to be able to learn from their experience. They are suffering from high inpatient capacity. Their healthcare system is overloaded. We do not want that to happen here in Fairbanks. The community is beginning to finally realize the seriousness of this situation with school closures and cancellations of large gatherings. We hope that this more aggressive response helps blunt the spread locally, but our concern is that enough patients have been recently infected that when they decompensate in a few days to weeks, our capacity will be overwhelmed. This is information that has been shared with us by an emergency room physician at the end of last week, with a message to help us understand how we can protect our community and not allow it to happen here. So what can we do? We can decrease the rate of spread. That's why we're asking for people to stay home and to practice social distancing. We can also protect our health system capacity. We are working together diligently as a medical community together to make sure that we have enough space, supplies, and staff to do the best job that we can. The main message here, though, we are asking everybody, we do not want our healthcare system overwhelmed. We want our community safe. We want our loved ones cared for. Please stay home if you have traveled out of state. Please stay home if you're sick, even if you have mild symptoms, a low-grade temperature, a little bit of a cough. Please stay home. And if you are needed for essential work, we thank you. Our healthcare workers, our first responders, our utility workers, we need you to help keep our community safe. But while you're working, please practice social distancing, keeping a minimal 6 feet apart from other people. I want to thank you for this time, and we want your help. If we all work together, we can keep our community safe. Thank you.